Something that I have learned over my lifetime, and especially during COVID, is to give people their flowers while they're here. So I am so excited to be able to introduce this woman who gave me a chance to be at the Coalition for the Homeless, who trusted me to manage the landlord engagement team. Shout out landlord engagement. Hey y'all. I cannot thank her enough, and I am indebted to her. So I am so excited to be able to bring up Anna Rausch. Um, she is our vice president. She is our vice president of program operations, and she will be telling us about the community COVID housing program, which we also call CHIP. Unfortunately, Jessica Preheim, who is our vice president of strategic planning, is unable to be here today, but major thank you to her. And then we will also hear from my awesome director, James Gonzalez, who is the director of programs, program operations, and then also another amazing director, Jonathan Danforth, who is the director of outreach and coordinated access, about our work and to decommission encampments in our community. So major thank you, major thank you, and please welcome Anna Rausch.
So I don't like to recruit from other organizations. I don't do that. However, I did recruit Ashley. Sorry, Avenue 360. After the great work she did with Harvey, she was just amazing, and I knew she was the right person for the job. So, all right, so I'm here to talk about CHIP. So I'm gonna go back a little bit and let's think about, oh wait, let me get my clicker. Hold on, let's make sure this works. All right. So let's all think back to what we were doing in March of 2020. Many of us were on spring break, including myself, and I was at my favorite place in the world, which is, thank you. Look at that. All of you know me. I was at Disney, yes. In fact, I was there when they closed the resort on March 16th, 2020, only the 6th time ever in its history that the resort had been closed, and I had now been there for 2 of those times. So that's a story for a margarita day or something. So we'll talk about that later. So when I got home, the coalition had made the decision to have staff work from home. And so every day, you know, we were working on Zoom, we were learning about Zoom, GoToMeeting and all that. And I was in different rooms in my house, my desk, chairs outside, enjoying the beautiful spring weather in Texas. And my back started hurting because I wasn't prepared to work from home. I don't really have a home office. And so I was thinking, this is gonna blow over. I'm an optimistic person, you know, glass half full. This is gonna blow over. I'm sure a lot of people were thinking that. And then my back really started hurting. And I finally had to go to the office to get my double monitors, my desk, and my chair so that I could properly work from home, wearing a mask for the first time, and we were on full lockdown. So the coalition had made the decision to jump into full disaster mode. So here's our wonderful Scott Moore, who along with, yes, along with many people in our organization, took turns at the office to help respond to the pandemic. Out to our partners immediately to make sure that they were able to continue to serve people experiencing homelessness, even while we were responding to the pandemic. We set up so many work groups. I think we had like 6 work groups. It was for the unsheltered, emergency shelter, permanent housing, communications, food and basic needs. We coordinated distribution of over 24,000 meals, tens of thousands of PPE equipment that was donated to us from very generous sponsors. In partnership with and with funding from the city of Houston and Harris County, we stood up an isolation and quarantine facility where people experiencing homelessness could wait for test results and recover from COVID. Within 3 weeks of the pandemic's arrival, we worked in partnership with Healthcare for the Homeless Houston and the mayor's office to help implement a dedicated COVID testing system for people experiencing homelessness. We worked with the Salvation Army of Greater Houston Houston and with funding from the City of Houston and Harris County to set up an auxiliary emergency shelter that allowed for social distancing and decompressing of our shelters. And we worked with partnerships from City of Houston and Harris County to set up 16 hand washing stations at hotspots throughout unincorporated Harris County, so that people experiencing unsheltered homelessness could, keep clean and wash hands and all that. We were meeting weekly with all of our city and county funders. Jess, Sarah, and I even set up weekly therapy sessions with our brother Mark, so we could keep in communication with what was going on at the mayor's office. And then, of course, the Coronavirus Aid, Relief, and Economic Security Act was signed into law on March 27, 2020. The CARES Act funding was intended to be a public health tool to enable cities to respond to both the economic and public health risks of COVID. Right away, we realized that we had to apply some lessons learned from 2009 from the HPRP program from that recession response where we developed our existing rapid rehousing program. So the CARES appropriation through HUD was specifically intended to be used as a public health tool to rehouse the homeless, permanently decompressing shelters and thus reducing the risk of ongoing community spread. Immediately, the idea started flowing on how we could use COVID relief dollars for permanent housing. The city and county reached out to the coalition to ask for help in determining how these funds could be best put to use. We were already at the end of a comprehensive 5-year strategic planning process, so we knew where some of these gaps were. We knew where we needed to put our resources. Jessica Preheim, my partner in crime, couldn't be here today, but she and I met and talked and argued and talked and argued some more. We had numerous internal meetings. We talked amongst ourselves, reached out to a lot of our friends that had worked in our community and were experts in the field on what we could do. And then of course we put a crazy spreadsheet together because we love our crazy spreadsheets, and what's a crazy idea without a crazy spreadsheet? And then when I first told my team about this crazy idea, they looked at me like I was crazy, which sometimes I felt like I was. And they were like, "Are y'all crazy? There's no way we can do this. We need more staff. No partner is gonna wanna do this." But the more the stubborn Brazilian hear things like that, the more I wanna do it. So they know not to say no, because I'm just gonna wanna do it. And so out of this, the Community COVID Housing Program, which we call CHIP, was born. I remember endlessly scribbling down acronyms. We love acronyms. And we were scribbling down acronyms on pieces of paper and sending them to each other in teams and laughing about it. And we finally agreed on CHIP, like you're eating a potato chip. There was nothing more to it. And then we pressed on. We got asked why over and over, and we had to explain ourselves over and over. We really knew that this was an unprecedented opportunity, the most effective public health response to reduce the community spread of COVID-19 amongst people experiencing homelessness was to ensure that all people experiencing homelessness had a permanent home. Rapidly expanding access, to housing would improve healthcare outcomes and reduce reliance on expensive emergency services like hospital visits, thus decreasing the burden on the healthcare system and reducing costs. And then, of course, used wisely, CARES Act funding would allow us to transform the homeless response system and get ahead of future demand for crisis housing due to the economic impact of the pandemic. So then on July 1st, the City of Houston, Harris County, the coalition jointly announced CHIP. The county portion of the funding got a unanimous vote at Commissioner's Court, which was amazing. The goal of CHIP was to accelerate the work of the way home by targeting approximately 5,000 people over the next 2 years, because for people experiencing homelessness, housing is healthcare. They really needed a place of their own in which they could be safe and isolate. CHIP consisted of several strategies that you see here. The Bridge to Permanent Supportive Housing, which was acceleration of people that were experiencing chronic homelessness, living unsheltered in encampments, would be housed immediately while they wait on a permanent supportive housing slot. Rapid rehousing was going to target 1,700 individuals for short-term 12 months of light services and rental assistance so they can get back on their feet. We had diversion to help approximately 2,000 people maintain or regain housing so that they do not have to enter emergency shelter. We had auxiliary social distancing, emergency shelter support, mental health case management for those that we were housing, enhanced street outreach and unincorporated incorporated Harris, Fort Bend, and Montgomery counties, and where we actually wrote the book on encampment decommissioning. And finally, we had housing preservation. The funding amount needed for CHIP was $65 million and came from several sources, with the city of Houston committing 40 million, Harris County committing 18 million, and the Coalition for the Homeless committing to fundraise for the remainder, or for what government funds could not cover. Some of these things were landlord incentive fees or basic needs, things that people could use to remain safe and stable in housing. After the procurement process, CHIP kicked off on October 1st, 2020. The goal to serve 5,000 individuals in 2 years was actually met prior to the first year anniversary of CHIP. To date, we have served 8,580 people. So yes, clap, that's great. These are some of the wonderful faces smiling and happy because they're going into their permanent homes. The success of CHIP led to the creation of CHIP Phase 2 to continue our rehousing efforts by serving an additional 7,000 people through the end of 2024, and an invitation to join President Biden's House America initiative, CHIP also led to being able to house more than 25,000 people since 2012, and a 64% decrease in homelessness since 2011. So this is fantastic. So here's the collaboration that several of you have mentioned so far. I do believe that this is a very powerful word. I get asked a lot, what makes Houston so different? And this is the word that comes to mind every single time. It is so hard to describe how everyone is always willing to help and to jump in for one crazy idea after another. When Jess and we spent the entire month of May of 2020 reaching out to many of you and doing presentations on CHIP and explaining it, and we were met with enthusiasm the entire time. We never once did we, have to go. 5 minutes, okay. And so, and so our COC is amazing in that we always support and look after one another. It's important to remember, and I want everyone to remember this, that CHIP was intended to accelerate the existing homeless response system. That means that CHIP agencies would be housed alongside current partners who are continuing to house people during the pandemic. Even while we were onboarding new projects and everyone was training, our existing partners were continuing their hard work. Some of these partners also expanded to participate in CHIP. This is the spirit of collaboration that's hard to describe into words. At the end of the day, we are the way home, working together to keep more than 8,000 people housed and continuing to house new people every day. Thank you to all of you.
Oh, yes. Now we will have James Gonzalez. Hi, Director.